Hi, this is Dr. Wayne Whalen, Chief Content Officer for HelpWhatHurts.com. I want to talk a little bit about plantar fasciitis, foot pain. So it's a common condition. It affects the connective tissue on the bottom of the foot. It goes from here on the heel and goes out under the rest of the foot up to about where the toes are. Um, it can be caused by a lot of different problems. One is really high arches. One is really low arches, like flat feet, or if you tend to roll your foot in. It can be caused by, which is called overpronation. It can be caused by tight calf muscles, standing or walking on hard surfaces a lot, poor footwear, prolonged standing, or a really tight Achilles tendon. We used to think it came from inflammation, but recent studies have shown it's probably not that. It's probably more likely little micro tears in the connective tissue along the bottom of the foot. So symptoms typically include pain in the heel, especially when you put weight on your feet, and um, one of the most characteristic things is that tends to be worse when you get out of bed in the morning. So your feet will kill you for the first couple of minutes. Once you've walked around for a while, it's not so bad. Same thing if you sit for prolonged periods and then you go to stand up, it's like it's killing you. Then after a few minutes, it's not quite so bad. So the diagnosis is relatively easy to make based on the history. And you might need x-rays just to rule out a bone spur, although we're not as concerned about bone spurs as we used to be. It can take a long time to get better. Treatments typically include putting something under the foot to protect the arch, to prevent the arch from collapsing. That's orthotics, and there's lots of different ones out there on the market. Some aren't worth the money at all, and some are overpriced. I guess you need to trust your practitioner that what they're providing you is in your best interest. No one therapy has been shown to be most effective for this problem. There are lots of different approaches. Physicians used to do a lot more steroid injections into the bottom of the foot. Makes the foot feel a lot better, but again, after a while, it begins to weaken that connective tissue even more, and you tend to have further problems down the line. So it's not used as much as it used to be. Other therapies include things like low-level laser therapy or extracorporeal shock wave therapy, which is where sound waves are pounded at the bottom of the foot, and they cause little micro tears again in the connective tissue on the bottom of the foot, which is thought to stimulate healing. Another more recent approach is to use PRP or platelet-rich plasma injections that again are designed to help stimulate healing. Surgery is very rarely used, but it may be the last resort. You can check out all these options on our website, helpwhathurts.com. I'm Dr. Wayne Whalen. Thanks for your attention.